welcome everyone to the Eyecare Experts. I'm Dr. Bell, Dr. Terrezza, and we have with us Dr. Hannah Sahawneh.
Yes.
So thank you for being here, and we appreciate it. You've been here before, but it's been a couple podcasts back.
We expanded our family, became a new mom, so so we had some time off doing that, but I'm happy to be here.
Are you sleeping?
No. You don't ask a new mom that. I am not.
Well,
so when we get to the part about sleep deprivation, I can speak personally on that.
Well, we appreciate it. And we're glad you're back for sure. And for the viewers and even patients that you've seen, where are you at location-wise now? Tell us a little bit where you're practicing at, days you're there in clinic and stuff.
So now I'm back at the downtown Palafox location. So I'm there Tuesdays and Thursdays. We've got a new Baptist location open at the Baptist campus at the Henderson Health Center. So I am seeing patients there as well on Wednesdays. So I'm happy. I'm excited. I'm happy to be back. It's been really nice.
And for any of y'all, if you want, we have locations, there's numbers to each location, but TerrezzaOptical.com, if you go there, you can certainly view some of our prior podcasts under that. There's a tab at the front under resources, but also, call an office if you're looking to see Dr. Sahawneh, Dr. Terrezza, or myself. Terrezza probably goes to more offices than all of us, but certainly they can direct you, to which office is closest to you, maybe which provider you want to see, which insurance you have. We can kind of work through all that and get you scheduled accordingly, whether it's a full exam, an office visit, or what have you. How many offices do you work at now? Are you at, have you thought about how many you go to?
Well, I visit them all, but I go to 3.
You practice at 3?
Yeah.
Gotcha. Well, topic-wise, we're talking the one that seems like it's becoming more and more relevant nowadays, especially with macular issues and pigment issues. But smoking, we're talking about smoking and how other habits impact the ocular health, the eye health. And you want to start with that, Dr. T, or kind of take it? What do you think? Yeah?
Well, yeah. The two major, so the number one cause of blindness in people over the age of 55 is a disease called age-related macular degeneration. And in fact, if you smoke, you're either 2 or 2.5 times more likely to get that disease. And so that's something to think about right off the bat. And it's a very debilitating disease. You lose your central vision, and you're very limited in what you can do. Your quality of life decreases. But probably more than that in terms of incidence is cataracts. And the mechanism, I'm not sure if it's fully known yet, but it makes sense to me because the eye requires so much oxygen and breathes for itself. So the smoke interferes with that directly.
Yeah, when we are looking at the tissues of the eye and everything it needs to stay healthy is oxygen, like you said, but something that happens when there's damaged tissues or lack of oxygen or decreased perfusion is oxidative stress, which then releases free radicals. And those free radicals will go through and damage all of the tissue of the eye. Something I like to tell my patients is that it's the same eye you were born with, and we are living longer and longer and longer. So we're extending our lifespan so many years, but it's still the same eye tissue you're born with. And so we have to do a really good job of taking care of that tissue because it's so delicate. And so any extra oxidative stress or free radicals that build up on that tissue is very bad and can take away a lot of that vision.
Well, both of y'all spoke of macular changes, macular degeneration, and we're going to get into kind of the different types, wet versus dry, and some will say exudative versus non-exudative. We'll get into that a little bit, but I know for those patients, when I see a patient that has, early drusen changes or earlier macular degeneration changes, the first question I always ask them is, do you smoke? I ask that because I want to know, because the chances certainly are increased greatly with that, but also that it helps me sometimes as far as which supplement, which vitamin, what are we going to offer them based on that.
I will say that this is not just specific to cigarette smoke either, as vaping is becoming more and more prominent and younger. So it does also apply to forms of vaping as well. So anything that's going to be inhaled and upset that really delicate balance of oxygen from our respiratory system into the rest of our body. And that is something I also tell patients. I'm like, you can't really modify aging. We want to keep living longer. But smoking is the number one modifiable risk factor. We can't change our genetics. We can't change our family history. We can't change aging. We can change our habits. And that habit alone can extend the life of your eye and all the tissues along with that many, many, many years just by stopping.
And being aware, we're talking, certainly if you're the primary smoker, you've got the smoke in your direction, but even secondary, tertiary smoking, be cognitive of kids that are around you, other family members, that may be getting that secondhand smoke. So just be aware of your surroundings and, how it can affect others too, besides yourself.
The secondhand smoke, I think, is also something that maybe smokers don't always think about, but then there's also third-hand smoke is also something that can come up, especially in children. Third-hand smoke is not only secondhand smoke, you're inhaling the excess smoke, but the third-hand smoke is when they're actually touching any toxins or residue that smoke has landed on, furniture, carpet, anything like that. It's pretty harmful for children and pets. So they can, the secondhand smoke can be a third hand as well. So it can be a 1-2 punch there for other non-smokers.
Well, the thing we always say, even in our older is, detection, early detection of anything that's going on. That's the reason we strongly encourage everyone, come in for that full comprehensive exam at least once a year. And then based on the condition that you have, we may see you more often than that. But certainly detecting these things early, whether it's macular degeneration, whether it's cataracts, or whether it's glaucoma, some of these conditions like glaucoma, you will not even know you have it until late stage. And by then, you may have already lost, quite a bit of your side vision. So it's very, very important for these patients to be seen regularly. The patients that I worry about the most are the ones who come in every 3 years, every 5 years, just infrequently, and a lot of things can happen in 3 or 5 years' time. So just be aware of that. As far as macular degeneration, wet versus dry, our old way, we talk about Amsler grid, but we've even had a podcast on this as far as the Foresee home and how it's changed as far as monitoring progression of macular degeneration and that sort of thing. Foresee.
As a reminder of wet versus dry, that's something that kind of goes with we know those terms. Sometimes patients don't really know that there's different types and what that means. And at this point, it used to mean one we could do something about, one we can't. But there are new treatments and everything coming out. But as a reminder, dry macular degeneration means that there's not any bleeding yet. And we kind of stage dry macular degeneration up until the severity of when it can transfer or convert to wet macular degeneration. The entire goal is to keep it either very early dry macular degeneration or a very slow progressing dry macular degeneration. And when we first see those subtle signs in the very early dry macular degeneration, we're having this, like you said, the conversation with the patients about their lifestyle. What are they doing? What aren't they doing? When we're talking about that, it's to ultimately keep the eye from progressing any further. We can't undo what's already there. So we want to have the conversation of how do we slow this down or make it so it's not going to worsen really quickly and take away that precious vision. Because something that we do know is that when it worsens and it takes away that central vision, it can really be devastating. Like you said, it can take away their independence, their driving license. The biggest complaint I get is that they can't see their children or grandchildren's faces. So things like that can really alter their ability to enjoy daily life.
And I think in general it's more devastating because certainly with glaucoma we talk about peripheral vision and you usually don't notice that until it comes all the way around. But with macular degeneration, that's taking away your central vision, where you focus, where you read, where you're looking at. And certainly if it gets to be wet, you're going to notice because it could be a blurry spot or even a blind spot in that central vision. And certainly we want to try to avoid that at all costs, catch it early and try to slow it down, try to keep it that early dry as long as we can.
And because the macula is so important for the eye and the retina, that's where a lot of that damage does build up because there is so much need and so much cell turnover and there's so much physiologically happening in that location that it's a prime place for oxidative stress to build up and deteriorate the overall tissue, which is very sad to see.
Well, the one thing that certainly, I guess when I first graduated school, it came out shortly thereafter, is we always get the question, hey, I have family history of macular degeneration. My mom, my grandma had wet, had dry, had this or that. What are the percentage chances that I get it? And, it used to be, hey, we think it's going to be this, but nowadays with DNA testing, swabbing DNA, it has gotten pretty reliable as far as knowing what the risk factors are and what the percentage chance is that they may or may not get it.
I think when they do genealogy now, it's almost always in that standardized kind of swab test that they will check for within your family tree or family inheritance risk, which is fascinating. It's amazing where we're
Yeah.
at.
I mean, it's amazing to say, hey, your percent, and that's a good thing to know. I mean, ahead of time, that way you know what your risks are, and usually the treatment for this, and even glaucoma, I always tell people the treatment's really nothing to lose sleep over. The treatments are usually, drops or taking this supplement or doing this or that, but certainly to lower that chance significantly so it never gets to that point, that's a big deal. It's a big deal.
I would agree. And I think that's something that, I mean, most smokers know smoking is bad for you. So when we're talking to smokers, sometimes I kind of see the light bulb go on with patients when they say, oh, I didn't know it could affect my eyes. And then now that it is, maybe that's that extra bit of motivation they need to talk to their doctors, to talk to their healthcare team, to put together a plan of managing that risk and how to modify themselves or ultimately quit smoking. Because we know that within days of quitting smoking, there's so many benefits your body gets already. You get increased blood flow, you've got all this extra perfusion, way less oxidative stress, like even just within days of quitting smoking. And so any little bit that we can get a patient motivated and use that as a goal to move that needle towards quitting is something I definitely like to chat with patients about. Because sometimes they don't know that that's something that can change.
No, good stuff. The other things is simple, even if it doesn't lead to, let's say, cataracts or macular degeneration, just tear film issues on the eye. Dryness is something we always talk about, and it seems like dry eyes, as far as day in and day out, that's the one I get the most complaints about, as far as they're gritty, they're sandy, they're blurry, I'm doing this, I can't do that. And so, just the smoke and even alcohol use can kind of dry out the eyes, and they get red, they get irritated. So dryness is,
True for the skin, just from a cosmetic point of view, the skin dries out too, and has a dry, older appearance. And for what it's worth, that should be motivation there.
It is for me.
Good. Well,
I'll take anything to keep that youth.
well, the other one, I guess the only other one I can think of that we talk about sometimes is the direct or indirect relationship with like diabetic retinopathy and things like that is affecting, because we've already talked about oxygen delivery, we've talked about the increased oxidative state, and certainly a lot of that plays in when we talk about diabetics and blood flow and leakage and how it affects the nerve, how it affects this and that. So there certainly is there's a relationship there.
Yeah, I mean, the eye itself is a very small organ, and then the blood supply and all the tissues are so delicate and even tinier that any metabolic conditions, any excess stress you're putting on those tissues, it can show up in really big ways. And we only have two eyes, and we can't really fix them neurologically yet at this point. So it's something that if anything you can do to prevent that and help prolong the tissue health, since our lifespan is being so lengthened, that's what we want to do.
Well, here's a question for all of us, and I don't think we'll all have the same answer, but this is one I'll be interested to hear what you guys think. If a mom says, hey, I have that family history, and let's say mom is 45 years old, and you don't really see any drusen, you don't see any macular changes at this point, but she says, hey, my mom has been taking this supplement or, with all these vitamins, and we can get into some names of those, but what do you tell her if she goes, I would like to start on them, do you think it's a good idea? What do you tell patients as far as, before you see signs, is it worth it, not worth it? What would you tell that mom that just thinking about starting on some supplements, and because she has other family members that do? What do you usually say? There's no wrong answer. I'm just curious what you guys
Well,
think.
I just set in my ways. I run the Maculogics test, which is a virtual reality test that can pick up changes that are not visible to the human eye. So you can get it up to 18 months to 2 years prior to that, particularly if there's a family history there. And if there's a family history and they don't do well on the Maculogic, then I will start them on supplements.
Yeah.
I kind of talk through their lifestyle. So are you smoking? We talk about quitting smoking. Are you wearing sunglasses? We are here in Florida. There's a high UV index, and that's something that we talk about. Got to protect yourself from sunglasses. And then we talk about their diet. Honestly, your supplements are based on things that we get from nutritional sources. So I talk about, are we eating our leafy green vegetables? Are we having a really varied, almost like Mediterranean diet is what a lot of it's modeled after. And if they are doing all of those things and then they still want to talk about adding that in. Then we talk about the pros and cons of that. Is there like the cost of it? Is it easy to access for them to get to? We talk through the research and saying, there's research both ways on that. So I kind of talk, it's almost patient by patient, but I definitely look at it as like a whole picture of what are you already doing, what can we modify, and then we kind of talk through the rest of the risk factors.
Yeah, and to be honest, some of the patients may already be on some of the stuff, lutein, zinc, beta carotene, maybe not on the pigment, zeaxanthin, and all that stuff. So figuring out what they're already on, and just cost, is it worth it? Just trying to figure, and each patient's different, so we've got to figure out what the risk is, what the family history is, how do they look. And I think that's the reason it's so important to come in, not only to get the full comprehensive exam, but also, so we can run maybe an OCT scan of it. We can get you on the Maculogics, because those machines, we can see a lot just by looking at photos and looking in the eye. But sometimes the smallest detection, the earliest detection with some of the machines we have nowadays are great. They're able to pick up things early, and they can monitor and notice any changes as we move forward.
And even if we don't see anything, it's still good to have that baseline, because then going forward, we can preventatively watch that. Especially at the end of the year, with, like you said, the dryness, with the holiday changes coming up, I know dryness is already an issue. Seasons change, allergies, all that. So smoke in the air just makes it even worse. And so honestly, during the holiday season, that's kind of when I get more complaints about that. And then I'm asking them, are you smoking? Are you using things that are going to inherently irritate your eye?
I think it's gravely underestimated by most folks. And unfortunately, it relates to quality of life. So, and length. Gosh, what else do you want? Those are two things that are critical in happiness.
Well, the eye certainly, with us looking in, it's the only place you can see without cutting beneath the skin, to see the vessels, the blood flow, to see the nerve. And there's a lot we can tell by looking in the eye. And I know for some patients who don't like dilations, dilating the eye and giving us a better look, asking all the questions we ask about, hey, what medications are you on? What systemic conditions do you have? These are the reasons we ask all those questions, because it helps us to kind of best treat you. Certainly we want to get you seen the best, but we also want to make sure the eyes are healthy, make sure there's nothing else we need to do at this point. And going forward, how can we best, watch you, treat you, and monitor any of those changes? But we certainly appreciate you guys listening. You can go to our website, terrezzaoptical.com. Again, any of our past podcasts and the future ones that will be coming up. Thank Dr. Sahawneh for joining us, and we'll see you next time. Thank you.